We've just got the strain package on our Vinno D6 and I'm going to show you how to use it. The first thing to note is that you do have to have ECG, which is a bit of a pain, but standard for most strain packages, I suppose. Now, with strain, you always want to have the best possible frame rate. My dog actually has a dilated left ventricle, so I always have to increase my image angle really as much as I can to get all of her ventricle in. So I'm really going to make sure I reduce my depth to try and get the best possible frame rate I can. Once you've optimized your image, you're going to freeze it, and then you can hit the strain button, which is a little icon of a heart. You select which view it is. So this is the apical 4 chamber, AP4. And click VRD for autosave. Now, if it gives you a message that the selected frame lies on an incomplete ECG cycle, then you can scroll back through and you get your little marker to tell you where the ECG cycle you are. Pick it at the beginning of a QRS and try again from there. And then it should work. So now you can click Draw ROI and put it at the hinge point on one side, the apex, and the other hinge point. And it will draw you some sort of an approximation of a curve. So I'm just going to make sure my dog doesn't fall off the bed. And now I'm going to improve this. So using the tracker pad and using Enter to move the curve, I'm going to make sure this really fits the shape of her ventricle, which is a little bit rounded because it is dilated. So if you're wondering why it's not a pure bullet shape, that is actually the shape of her ventricle. It doesn't do very well, I've noticed, if you try to track into blackness. You should never do that anyway, but in clinical practice sometimes people do have a tendency to try and imagine where the border would be, but if you do that on this strain software, it tends to just put that piece as completely akinetic. It doesn't seem to fill in the gaps. So you really have to make sure with this strain package that you do get the whole of the ventricle in your image, which is probably a safer thing to do anyway. So now I'm kind of happy with that curve. I want to see how it performs, so I'm going to click 2D tracking. Then you just have to give it a few seconds for it to compute, and we'll see whether it's actually managed to track or not. And here is our result. I'm actually pretty impressed with this. So her strain is reduced in the basal septum. I would expect that. She has a ventricular septal defect. I wouldn't expect her to have a normal GLS value. One other thing to note is GLS is supposed to be more reproducible than other types of strain. And actually about half an hour ago before making this video, I was practicing the software to make sure I didn't look like a complete idiot on this video. And I acquired the same views at a different time point, and I actually, believe it or not, got -17% as my GLS value, and that's exactly what I've just got now. So I have spontaneously found out that I am actually quite reproducible using this software between different time points on different images. So that is also really reassuring. So if you're happy with that image, you can then press Accept on your touchscreen, and it's going to store that for you and put it into your report. It will also start to build your bullseye plot. So if you then want to go and obtain a 2 and a 3 chamber view, for example, it will start to fill in that bullseye for you. It's not so important with veterinary echocardiography, where we don't usually have regional wall motion abnormalities. Usually you can get away with just a 4 chamber strain, but it's good to know that you can do that if you're looking to do a really comprehensive study.